Hello and welcome to the Pharmacy Informatics Professor 2020 with your host, Dr. Armin Simonian. This past week, I was listening to a lecture at the ASHP mid-year that was focused on medication safety, and it was relating to automated dispensing cabinets. And it made me think back 25 years to my first job as a pharmacy informaticist, and when I was working on my first implementation of a medication use process technology, automated dispensing cabinets. The lecturer was talking about workarounds that some of the nursing personnel did to divert medications, and these included doing an inventory of the pocket or using the cancel transaction to open a pocket, remove a medication, cancel the transaction, and make it look like it didn't happen even though medication was removed. So I thought back to when I was first implementing automated dispensing cabinets and some of the proactive steps that we took to make sure that those issues didn't occur. I'll say to you that anytime you're implementing a new technology, you want to have two documents in hand. One is the training manual for that technology. You want your personnel to be well trained, to be competent on that system, and to test their competency at the beginning and probably at intervals, at yearly or other intervals, to make sure that they're still competent on the system. Remember, with medication safety, we talked about the Swiss cheese model. That's when you have barriers that are represented by slices of cheese, and there could be holes in those barriers. And if the holes line up, there could be an adverse drug event that reaches the patient and causes harm. So we want to avoid that at all costs. Now, one of the holes in your Swiss cheese model might be personnel that's not properly trained on your technology. And so we want to make sure and plug that hole, make sure that our personnel are well trained. The other document that you need to have is a document that says how you're going to use that technology at your institution. And that's your policy and procedure document, your P&P. So developing a P&P, something that you might do from scratch, or you might work with your vendor to get a template, or have your vendor contact one of their current clients on that technology to see if, with permission, you can get a copy of their P&P and then customize it to your institution. Remember, it talks about how you're going to use that technology, that particular technology at your particular institution. So it's customized to your site. I do have an example of a ADC P&P, a policy and procedure that I developed a long time ago for automated dispensing cabinet technology. And I want to share that with you. I don't want to share it as a template. I just want to give you an idea of what a P&P looks like and the topics that you might address in an ADC P&P. And that will give you kind of a guiding light on which way to go for developing that document. Let me call up the document and we can start talking about it. So here at the top in section 1, I have the purpose. So we're writing this P&P to establish best practice for our ADCs. How we're going to use these machines at our institution. Okay. The next step is to have definitions. Now, if you're a pharmacy informaticist, you might be aware of all the acronyms and all the little different technology names and features within a system. So it might be okay for you, but for the end user, it might be a problem. They might not know all of those different titles, names, and acronyms. So we want to define those up front for all of the medical, nursing, pharmacy users that might use the system. Okay. All right, moving down, after we get through our definitions, we want to start talking about the text of our procedure and policy. So we need to have a policy on security. Who will have access to the machine and what kind of access will they have? What level of access? And even within the pharmacy department, what level of access will the pharmacy informaticist versus the pharmacist in charge versus a staff pharmacist versus an intern or technician? What kind of privileges will they have on the system? And then you also want to define the privileges for nursing personnel. You know, with ADCs, the nurses are the primary users of that system. And then we also have physicians, respiratory therapists, and other disciplines using those machines. So we define all of those in this section. So here we have pharmacy personnel, then we get into nursing personnel, and you notice that even within nursing personnel, you might have RNs, LVNs, LPTs, traveler nurses, per diems, registry, new grads, and preceptors, instructors that might not necessarily be nurses that work at your hospital, but they might be from a school of nursing that are coming in and supervising nursing students. So we need to define who will have access to what. Okay. And as I mentioned, there's other personnel that use those machines, such as a respiratory therapist who might be removing nebulizer meds or inhalers from the system to administer those meds to patients. And so we have to define what kind of access they have, which pockets they'll have access to, which meds they'll have access to. All right. And then with our ADCs, we have a lot of information that's traveling through interfaces. We have our admissions, discharges, and transfers so that the patients show up on the machines, but we also want their medication orders to show up so that if we're in the profile mode of removing medications based on verified orders, medication orders for that patient, then we want to make sure that those orders are traveling at the proper time after they've been used or reviewed by the pharmacist, and then going to the appropriate machine, and of course being deleted when the medication is DC'd. Okay. So we want to have policies and procedures around all of these events that can occur on the system. And then when it comes to removing medications from the machines, how do we want the nurses to do that? Do we want them to remove medications for more than one patient at a time or just one patient at a time? And once they remove it, do we want them to put multiple drugs in their pocket? Or do we use a receipt slip or some other method for making sure that the right drug gets to the right patient? These should all be defined. What happens if it's an ESO med, an emergency standing order? How are those meds taken out of the system? We want to talk about overrides on our system. So if there's a medication that's needed right away, the prescriber or provider is right there. Ask the nurse to get an emergency medication, maybe an antidote such as naloxone out of the machine. How does that occur? And then how do we follow up on those overrides to make sure that an order is eventually written and verified by a pharmacist for accuracy and appropriateness? We also want to make sure that those meds are documented on the medication administration record for that patient so that they know that they got that medication. Right? So there's a lot of information that you can include on overrides. This is something that the Joint Commission always looks at very closely. And then what happens if the whole system goes down? If your whole electrical system within the hospital goes down, the generators are kicking in, there's a problem with the machines if they're not on emergency power, and if there's another disaster where basically you need to open up those machines so that the patients can get the meds that they need, even with the lack of electricity, then all of that has to be defined within your P&P, how you're going to handle those situations, because even though they might be rare, they do occur. Another major area, especially when you're talking about diversion, is the wasting of medications. So a nurse takes out a 4 milligram morphine syringe, administers 2 milligrams to the patient, and then is expected to waste the other 2 milligrams. Do you have a witness? Who can that witness be? And then how is that documented in terms of wasting that extra 2 milligrams of morphine? If there's a discrepancy on the system that the count within a pocket is not appropriate, there are fewer drugs in the pocket than are supposed to be there, how do you resolve those issues? How do we replenish the machines? How do we make sure that the meds that are in the machine are not out of date and that we're replenishing them with new stock and that there's proper turnover of that inventory? And then lastly here I have downtime procedures. So downtimes do occur, and we want to spell out very specifically what our staff are supposed to do when a downtime does occur. And in this P&P, We actually have a grid that says the type of failure that might occur, and then what the user is supposed to do and who they're supposed to contact, whether it's the ADC vendor, the pharmacy department, engineering, or the IT help desk. Okay. And then once the power comes back up, what do we do to get things back on track? And then quality assurance is really important. We want to make sure that these machines are being used appropriately, that we have the appropriate documentation, especially when it comes to controlled substances. But even with non-controlled substances, we want to make sure that drugs are not being diverted, disappearing out of the machines, that we're accounting for every dose. So we want to do checks on the machine, and we want to make sure always that the right drug is going in the right pocket, because the wrong drug goes in the wrong pocket, you can have an adverse drug event for multiple patients, right? Once a policy is written, before it's implemented, you want to make sure you get approvals from your P&T committee, your pharmacy and therapeutics committee, and then also human resources, since we are talking about the behavior of our employees and what they're expected to do, what the expectations are. And then, of course, with pharmacy informatics, information systems is a direct partner. We want to make sure that whatever is in that P&P is considered appropriate by the IT department. Okay. So with that, I'll say, make sure that you have two things when you're implementing new technology. Make sure that you have a training manual and that your staff is properly trained and competent on the use of that system. And then have a P&P, a policy and procedure on that technology, to make sure that everybody knows how that system is supposed to be used at that institution, what the expectations are for the proper use. If this was helpful to you, go ahead and like this video and subscribe to my channel. I'll continue working on more episodes, but in the meantime, stay safe, stay healthy, look after the health of others, and I hope to see you next time. Take care.